Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today's topic in Neighborhood Health Watch: why does the risk of birth defects increase as women get older? Women have all heard that as you get older, the risk of having a baby with genetic disorders goes up. And infertility, miscarriage, and Down syndrome are more common. Doctors say it affects women in their 30s and 40s and also men in their 50s and 60s. Dr. George Tidey with Henrico Doctors Hospital is here to get us informed. Thanks a lot for joining us. We appreciate your visit here today. But let's start out with, why is there a risk as women get older for birth defects? What happens? What's the link between abnormal eggs and age?
Well, we've known about the problem for a long time, but what we've learned in the last few years is how frequently the egg in particular makes mistakes as it gets ready to get fertilized, and the wrong number of chromosomes end up in the egg, which results in a pregnancy that won't even implant, or sometimes will implant and then miscarry. And then more rare would be the Down syndrome baby.
Do other factors come into play in addition to age when you're talking about infertility and even birth defects?
Well, certainly we see a decrease in function of the sperm as men get older, but the genetic issues seem to take the front responsibility and predominate in the causes of both fertility as well as miscarriages and birth defects.
When should a woman consider freezing her eggs to preserve the hope of ever having children?
Well, we see fertility start to decrease at around 30, but we see more significant problems in the upper 30s. So I think as women get to 37, 38, we see a pretty marked increase in the number of genetic errors in the eggs, close to 75% by the time they reach age 40 will be genetically abnormal.
And quickly, as we close, what about testing and screening? Are there new advances to
We don't
address
have
this?
very good tests for egg quality, but we do have tests for egg quantity. There's a new blood test which is pretty accurate in predicting how soon women might run out of eggs and might run out of time in terms of their egg quantity as well as their egg quality, which we know is more closely related to their age.
All right, very good information. Dr. Tidey, thanks a lot for joining us.
Thank you.